Over the past few months, we have learned more about PPE than maybe we ever wanted to know. Today, our 9 Health expert, Dr. Payal Kohli, gives us the facts along with a history lesson. So, Dr. Kohli, good morning. So, how long has PPE actually...
Good morning, Gary.
Good morning. How long has actually PPE been around, and what did they do like before it?
So, Gary, there's actually many lessons from history that say that it can date back to as early as 1300s during the bubonic plague. And then there's also artwork from 1656, such as depicted here, that shows that PPE has actually been in use for many, many centuries, and we've learned a lot. So if you look at some of the artwork back from 1656, such as this one, this is an image of what was called a plague doctor. And when you first look at the image, it looks very grotesque. In fact, it actually inspired fear for many years because it was a sign of imminent death. And this is so different from the heroic images of the doctors that we see now. But if you look closer, you'll see there are actually a lot of similarities to the modern day doctor. So let's go head to toe here. He's wearing a wide brimmed hat, and the hat is not just meant to be part of his PPE, but it's also meant to be his ID card. So all the plague doctors had the special hat that would identify them so people could actually stay away from them because they could potentially be infectious. You can see the long robe, the shoes, and the gloves. Those are all barrier protection, also part of his PPE. And then you see that he's wearing this beak mask. And the mask is actually, the beak is filled with lavender flowers in order to keep bad smells away. Because back in the 1600s, they thought that disease was actually, passed through smells, so it would keep the plague away. It also made the mask easier to wear, so more breathable. And then you see a cane in his right hand, and the purpose of the cane is to remind him to keep at least that much social distance, and also to examine patients from a distance.
The Death Doctor. That is pretty wild stuff.
That's right.
So
that's right.
About when did we get the modern version of these items, the PPE that we know?
Well, that's come more recently in the last few years, and it continues to evolve, as you can imagine. Manufacturers are changing. We learn more about how PPE and barrier protection works. And as we've talked about on the show before, different types of masks and such are continuing to evolve. So that's actually been a more recent phenomena. But the artwork really does help to reflect kind of the evolution of how we think about medicine. So if you look at this other piece from the 1800s, you actually see a very different human side of medicine. So here is a doctor leaning into the patient, showing a human connection, very different from the social distancing that we saw in the first piece. But you also see that there's a sense of helplessness because there's no equipment, there's no tools, there's nothing around, and really the doctor can't do much to really combat the virus that the young child has. Very similar to the situation that we're in again right now. So the doctor's become more of a spiritual figure. And heroic, very much at the center of the painting. Again, very similar to what we're seeing in modern day medicine.
Pretty interesting stuff. Yeah, for sure. Well, thank you for that. I learned a lot about doctors back in those eras from Dr. Quinn, Medicine Woman. You might be too young to remember that, but it was a TV show that I used to watch.
I do remember that.
Jane Seymour, remember that? And she was always wearing that stuff out.
Mine was ER, Gary.
Out on the prairie.
I would always watch ER.
Right. Okay. Well, thanks for that. It's always good to see you. Take care.